Infection control is a critical aspect of nursing care. As a certified nursing assistant, CNA, your role in preventing the spread of infections is essential to patient safety and health. Understanding how infections spread and how to prevent them will help you provide better care and protect both your patients and yourself. What is the chain of infection? The chain of infection is a model used to understand the process of how infections spread. There are 6 links in this chain, and each one represents a step in the infection process. If any link in the chain is broken, the infection will not spread. Let's start with the first link in the chain. The infectious agent. The infectious agent is the microorganism, such as bacteria, viruses, fungi, or parasites, that causes the infection. Some common examples include bacteria, Staphylococcus, Streptococcus, viruses, influenza, HIV, hepatitis B, C, fungi, candida, yeast infections, parasites, protozoa, helminths, worms. How to break the chain. Early detection. Identifying and diagnosing infections early helps prevent the spread of infectious agents. Proper sterilization and disinfection. Using disinfectants and sterilization methods to kill microorganisms in equipment and surfaces. Now that we've covered the source of infection, let's move to the next link. The second link in the chain is the reservoir. A reservoir is any place where the infectious agent can live, grow, and multiply. These are environments where pathogens thrive, and they can be humans, infected patients, healthcare workers, or even asymptomatic carriers. Animals. Infected animals can transmit diseases such as rabies or Lyme disease. Inanimate objects. Contaminated medical equipment or surfaces. Water or food. Contaminated food or water can be a source of infection such as Salmonella or E. coli. How to break the chain. Hand hygiene. Proper hand washing and use of hand sanitizers reduce the transmission of pathogens. Proper waste disposal. Safely disposing of contaminated materials such as needles and dressings. Proper cleaning and disinfection. Regular cleaning of surfaces and medical equipment. From where pathogens live, we now look at how they leave. The third link in the chain is the portal of exit. The portal of exit is the route through which the infectious agent leaves the reservoir. This could include respiratory tract, coughing, sneezing, or talking; gastrointestinal tract, vomiting or diarrhea; urinary tract, urine, especially in urinary tract infections; blood, through cuts, wounds, or invasive procedures; skin, open wounds or rashes. How to break the chain. Covering coughs and sneezes. Using personal protective equipment, PPE. Practicing proper hygiene and hand washing. Once the agent has a way out, the next question is, how does it spread? The mode of transmission refers to the different ways infectious agents are passed from one place to another. Transmission may occur through direct contact, such as touching, hugging, or shaking hands, or indirectly through contaminated objects and medical equipment. Droplet transmission happens when coughing, sneezing, or talking releases infectious particles. Airborne transmission allows pathogens to remain suspended in the air for extended periods, while vector-borne transmission relies on insects like mosquitoes or ticks. Breaking this link involves proper hand hygiene, correct use of protective equipment, following isolation protocols, and regular cleaning and disinfection of high-touch surfaces. By interrupting transmission routes, we significantly limit the spread of infection. Now let's look at how these infectious agents enter a new host. The portal of entry describes the route by which infectious agents gain access to the body. This can happen through the respiratory tract when pathogens are inhaled, the gastrointestinal tract through contaminated food or water, or the urinary tract through procedures such as catheter insertion. Entry can also occur through breaks in the skin, like cuts and surgical incisions, as well as through mucous membranes in the eyes, nose, mouth, or genital area. Breaking this link involves practicing aseptic techniques during medical procedures, ensuring proper wound care, and encouraging vaccination to prevent common diseases. Protecting these entry points is critical to keeping patients safe from infections. Finally, let's examine the last link in the chain, the susceptible host. The susceptible host represents the individual who is at risk of developing an infection. Certain groups are more vulnerable, including infants, older adults, and those with weakened immune systems. Chronic diseases such as diabetes or heart conditions increase susceptibility, as do medications that suppress immunity. Poor nutrition also makes it harder for the body to defend itself against pathogens. This link can be broken by vaccination, ensuring patients receive necessary vaccinations to protect them from infections, boosting immunity, encouraging a healthy diet, exercise, and sufficient rest to strengthen the immune system. Prompt treatment, providing early interventions and proper care for vulnerable patients to prevent infections. By strengthening the host's defenses, we close the final gap in the chain of infection. As a CNA, your role in infection control is essential in preventing the spread of infections in healthcare settings. Here are some practical steps you can take. Follow standard precautions. Treat all patients as potentially infectious, regardless of their diagnosis. Practice good hand hygiene. Wash your hands before and after patient contact, before eating and after using the restroom. Use PPE appropriately. Wear gloves, gowns, masks, and eye protection when appropriate. Proper disposal of contaminated materials. Always dispose of needles, dressings, and other contaminated items in proper disposal bins. Educate patients. Teach patients about the importance of hand hygiene and infection prevention. A chain of infection is a fundamental concept in infection control. By understanding how infections spread and how each link in the chain contributes to that process, you will be better equipped to prevent the transmission of infections in healthcare settings. Breaking the chain of infection is essential to protecting both patients and healthcare workers. By practicing proper hygiene, using PPE, disposing of waste properly, and educating patients, you play a vital role in infection prevention and control.